there, my name is Ann Holmes, and I'm one of the owners here of Active Health Solutions in Prince George. And this video, along with my friend Judy, is to help women post-recovery from breast cancer surgery. So a partial mastectomy or a full mastectomy. And this, for me, is a labor of love because my mom lost her battle with breast cancer. Judy's lost her mom to breast cancer, but the good news is Judy is a survivor. So she is going to be my demo person, and she is going to show us the exercises. And so this video is for anyone that has immediately following a breast cancer surgery to about 2 to 3 weeks post-surgery. And then the next video will take you one step beyond that, and then the last one will be for more strength building. So this one's range of motion. This one's post-surgery, so go lightly, go slowly. Make sure that you stay moving. You can walk, you can swing your arms, but we want to keep everything pretty light. So you can use a stress ball if you want, and we're going to talk about that in terms of helping for lymphedema. You're encouraged to do some light work around your house if you want. But don't lift anything more than 5 pounds, and no vigorous things like vacuuming or gardening or things like that. And focus on keeping your arms and your muscles of your upper body moving. So no flinging, no overdoing it. You may have some imbalances depending on what side your surgery was on, but we're trying to rebuild and get back to some of those motions for you as you move forward into your recovery. So I'm going to talk you through it. Judy's going to work on the exercises, and hopefully you have the next 2 or 3 weeks where you can use this video and help you rebuild some of your strength and mobility moving forward. So the first thing that we're going to do is work with our wrists. So she's going to do 5 to 10 fists, and she's going to open them up.
So people could do it with us right now.
Absolutely.
If you're seated, if you're standing, make a fist, open it. Just like this?
Yeah, absolutely. And then once you've done 5 to 10 of those, if you wanted to add in a ball, you can do some squeezes. Now, I bought these just at the dollar store, literally for $1. And these will help with lymphedema. So if that's something that your doctor has warned you about, it's going to be an issue with cording and things like that. So she's just going to do 5 to 10 squeezes. And you can as well move them around, so a little, almost like a little bicep curl. So she's working on those, keeping things moving, still squeezing, still moving. So that's the start. So we're going to work from wrist into shoulders.
And we could do this any time of the day.
Absolutely. So anytime you're sitting and resting is a good opportunity to do these. The second one is palm presses. So in this prayer position, and then she's creating a little bit of tension, but now we're going to open up like we're reading a book. Read a book, and then sweep it around all the way through, and you can go both directions, and you can do like 3 or 4 of these. These are a little tricky. Hard to remember all the way through, right? And again, you may have one side that's working, one side that's not because of your surgery and where you're at with your recovery. Okay, so I call those palm presses. The next one is we call it the pitcher's protocol. So one hand up, one hand down, and we're going to, if you can, and again, drop those shoulders, create a little tension by pulling apart, and you can do a little squeeze. And then she's going to do 5 beautiful circles forward. And you can do these with Judy. Okay, and then you're going to go backwards, 5 circles backwards. And you will find, like, you can really feel these just starting to get a little warm, and that's great. But if your shoulders start to sneak up, I want you to take a breath and really drop those shoulders to make sure that they're not popping up on you. Okay, the next thing is some shoulder circles, and you're going to go forward and back. You can do like 5 or 10 in one direction, and then 5 or 10 in the other direction. And once those feel a little easy, you can get those elbows up, and this will make them a little bit more vigorous. So again, no flinging, no gung-ho. I want you to just create some range of motion, some mobility. And again, both directions, forward and backward. Okay, the next one, after you've done those shoulder circles, is shoulder flexion. So I'm going to have her with her back against the wall, and she's going to go with arms up, and what we're trying to do is get those thumbs on the wall. And this is very challenging, right? So you may have one that's a little imbalanced, right? We may have one we like to kind of sneak up depending if our shoulder's really tight or depending on where you had your surgery or if you have drains and other things happening, right? So we're going to do this about 5 times, just working those shoulders up into this overhead position. Okay, from there, you can go arms out like a letter T. Oh, sorry, she's still doing her 5. My apologies. 5 of them. Okay, arms out to the side. Now we can start to do a little bit of a wall angel, and you're trying to get your head and the small of your back and your shoulders on the wall. And this is really tricky, right? Because we're tight in here, and we've had it work in there. And so it may be a little bit sore in some of those muscles.
And the back, and most people have had a biopsy.
Biopsy, yeah. So that just even keeping it low if it's not going to go up, okay? So keep it low, keep it small. And then once that loosens up, hopefully in a week or 2 or 3, then we can go to letter T squeezes. So we're out here, and then she's going to squeeze her elbows in and then pop them back out. So hopefully you've got a wall in your house that you're able to do this. We're coming to you from our little community kitchen because we're going to show you a few other things that you can do with a chair and a countertop. So she's just in the process of doing about 5 or 10 of these little T squeezes. And then the next one is shoulder blade push-ups. So she's going to spin around, hands on the wall about eye level, and her arms are extended, and she's going to drop her chest to the wall and try and squeeze these shoulder blades together. Because when they round, they get kind of sitting up this way, and we want to try and get the muscles, bringing them back towards our spine. So it's like a little mini push-up on the wall where she's just dropping her chest and then pushing back. Okay, so these are shoulder blade push-ups. And we are trying to feel that squeeze right there through those little muscles. Okay, so that was about 5 or 10 of those, and then she's going to switch it to a cat, cow, and a crazy cat. So this is really opening up our shoulders. So she can show you on the countertop here, and it's a rounding of the back, and you want to push the spine to the ceiling and then arch it. Okay, and then push the spine to the ceiling and then arch it. Okay? So that's 3 there, but we can also do it on the chair. So you can do it on the back of a chair, but also if your blood pressure is feeling okay and your medications are controlled and you can get your head down, this is a really good exercise to do where you're just moving your spine up and down, right? Yeah, there we go. And you can also do it on the back of a chair if you need a bit more. But it's nice on the countertop or even the wall. Okay?
So that's the cat.
That's the cat, round. Yeah, and then we're going to sink it. There we go. And then hollowed back out. Okay, and then the crazy cat, if you want, you can even do it on the counter again, is just some bit of rotation here because our spines have we've been resting, and so I'm not sure we've done a lot of side-to-side movement and a little bit of rotation. Okay, so that's the cat-cow. Judy, can you come back and we'll just do this step forward? Well, I find too, a lot of us, when we've been sitting a lot, our shoulders get rounded, and this position where we get our hands behind us is quite challenging, and it gets very tight. And again, with your surgeries and with your procedures, we want to make sure that we're working the shoulders in all different planes of movement here. So that's a good one. And she's going to alternate with her feet.
Could you do this just On one side?
Yeah, absolutely. You can do it on one side or both sides, and depending on your range of motion, it's just to try and open you back up, especially if we've been sitting and resting and rounded. And once we've had surgeries, right, in our upper chest, it feels better to just stay shut, and we want to open it back up. So that's going to be important. Let's work on to some external rotation. So hands at 90, and she's just trying to go in and out, trying to get to 90. And again, this could be a limiter based on what's going on in that shoulder. Okay, so that's about 4 times, 5, and then again, you can do it 4 or 5 times, 10 times even. And again, no flinging. You're not throwing a frisbee here. It's a very deliberate movement with very controlled endpoints. And then she's going to spin around and do internal rotation. So trying to get a hand up in the small of her, or between her shoulder blades. So start in the small of her back and then move it up. Okay, and this again is rolling those shoulders back. And all of us tend to have imbalances, and then depending on what side your surgery was on could really limit your range of motion on this one. So that's internal rotation. So that's wonderful. Next thing we're going to look at is neck mobility. So working on some turns, some swiveling of your head, of your neck muscles, side to side. So again, 5 to 10 of those. And then we're going to turn and drop our chin down to our collarbone. And this one's tricky. I find when I do this, I turn and I want to bring my shoulder up to meet it. And we want to make sure that we're bringing our chin down to meet it. And you will feel tightness, especially if, you know, depending on how you sleep, our necks can get quite tight. Some interesting necks out there. We do get very, very tight with our necks. And then the last one is just side to side, trying to drop your ear down to your shoulder, down to the top of your shoulder. The last few things I wanted to talk about is just to reference how much sitting that we tend to do when we're recovering, and that's only natural. But when we sit too much, our pelvis tends to round under, and what I'd like to work on is just rounding our pelvis back the other way. So back in the aerobics days, we were all taught to tuck our pelvis, and we really want to be able to push it out and almost arch your back. So you want to poke it out and really back and forth a few times, because we want these long muscles that go up our backs to be able to fire and pull our hips back, right? That's very important. The last thing I wanted to show you is a few exercises in the chair. I'm going to pull it a little bit this way. There we go. And so with our low back health, it's going to be important for our hip flexors and our hamstrings to get them firing again. So she's going to extend a leg and then drop her chest down, and she's going to feel that right in the back of her hamstring. And we want to do this back and forth a few times. You can even hold it if you like, if you're feeling like you want to just breathe through it, because it's going to stretch and it's going to go urch. So she's trying to just get those hamstrings opened back up again. Looks good. Let's do one more on either side. You can do these, right, 5 or 10 times. I think we'll have done it about 3 times here. That's good. And then the last thing is our hip flexors. Yeah, and then you're going to swing a leg back. So it's the front of this leg here, opening that back up, and with full hip extension here, because we're good at sitting, right? We're good at being stuck in this position, so now we're opening it back up. There we go, looks good, and you can do that on the other side. And again, you can make it dynamic. So you're doing it, getting into the position fairly quickly, moving it, staying moving, or you can make it static where you would hold it for 15 to 30 seconds.
How would I make it dynamic?
So you would turn, up, and then you would shift around and go again the other way. So it's a lot of movement, but it's really to get us firing to be able to move our pelvis with those hamstrings to make sure that our pelvis is going to move, especially when we've sat for a long period of time to recover. So thank you for joining us. We'll look for our next video, which will be sort of the 3 to 4 to 5 weeks post-surgery. And I just wanted to let you know that this information has come from the guidelines from the BC Cancer Society with the discharge papers. So in case you were following along and you've seen some of this vocabulary in that booklet, here's a great example of what you can do, and thank you for joining us.